Welcome everyone. I'll let people join. Great, we can get started. So welcome to our webinar and thank you so much for joining. Today, we're very excited to talk all about IVF in Portugal at Ovom Care. My name is Leslie. I work on patient satisfaction at Ovom Care, and I will be your moderator and hostess this evening. And tonight, I'm very pleased to be joined by my colleague, Dr. Renato Martins, Medical Director of Ovom Care Portugal. Before we get started, we'd love to know where everybody is from. So feel free to put in the chat where you're coming from, what's your home country, and we can see where everybody's tuning in tonight. So let me read some answers. Okay, we have someone from the US, New York, nice. Someone from Spain, Madrid, amazing. Turkey, the UK, London, Berlin. Nice. Okay, so we have quite an international spread here. Lisbon, nice, great. Well, thank you so much for taking the time to join. We're very excited to all have you with us tonight, and we're gonna get started, and we can then move on to questions towards the end of the webinar. So before we kick off, I'd like to place a short disclaimer that this webinar is not meant to give any medical advice or treatment advice and should not replace any individual conversation you have with your doctor. So a few words on Ovom Care. We are a hybrid IVF clinic, and we leverage AI tools to improve IVF outcomes. So we use cutting-edge technology, transparent and accessible pricing, and also we have a patient companion app for patients to be connected and supported throughout the treatment journey. Our first fertility clinic is located in central London in the UK, and we're opening very soon a clinic in Lisbon in Portugal that Dr. Renato Martins can tell you all about. So I'll pass it over to Renato, and the stage is yours.
Thank you, Leslie, for your nice presentation. And I'm very glad to be with all of you this evening and hopefully explain a little bit more about Ovom Care Portugal. Alongside with me, I'm a fertility doctor for over a decade, helping couples that are unable to conceive. And with joining me, we will have Dr. Joaquim Nunes, which will be the clinical director of Ovom Portugal, Dr. Christina Hickman, and Dr. Ahmed, our clinical embryologists, joining us. As you can see, we are not all native English speakers, but we are quite fluent so that we can ensure you that you will have a clear and effective communication with everyone. And why should someone choose to do IVF abroad? Well, we can say it from our point of view, from Ovom, that we will benefit from a world-class care at a fraction of its cost, access to advanced technology that we have in place in Ovom, with support for travel and accommodation, and do that in a very scenic and very relaxing environment. And why should you choose Portugal? Portugal is actually an ideal destination for our patients because it not only offers world-class healthcare, but it does in a calm and beautiful environment, also in very affordable treatments. This is something that we are actually very proud of, and we want to make you very comfortable throughout your whole treatment journey. Taking into consideration that, for instance, we will have a pricing that it's 30% cheaper comparing to the UK and almost 70% cheaper when we compare to United States of America. Even when you compare not only the pricing that you have to pay for the procedure itself and medication, but also when you counterweight it with the flight expenses and hotel and food coming to Portugal, it's still pretty much affordable coming and choosing Portugal, not only for UK citizens, but also for the Americans. In terms of travel support, we can actually tell you that we've already ensured some reduced prices for our Ovom customers in recognized international high-end hotel chains like Sheraton and Oniria, which is, as you can see, right in front of where the actual clinic is going to be. And if you can take a closer look, this is the ocean. You have a golf course, lots of greenery, and this is the hotel, and the clinic is right across the street. As Leslie already told you, we are very transparent in terms of our pricing, and our pricing is based as well in this our calculator that will predict the probability of you getting pregnant. This is based on data that we can collect from your biography, from your previous medical history, gynecological, obstetrics, and reproductive history, as also with some clinical diagnostic testings and your lifestyle factors. And once you have a 65 or above percentage of likelihood of getting pregnant, you can apply for the No Baby, No Fee program, which will reimburse you at 75% of the core treatment cycle costs if you do not get pregnant. That's how confident we are on our technology. Also, you will have something that's quite outstanding, which is the Ovom Care Companion app, which will allow you to stay in control and connected every step of the way with this Fertility Companion app. It has been designed for Ovom to empower you and to allow you to have a word throughout the whole treatment, and with communication in real-time updates with our clinics. And how does this process actually works from now until you get pregnant? So you will have an initial consultation, some diagnostics, a planning, a nurse consultation. Then you'll be going through stimulation and monitoring, egg collection, embryo transfer, and hopefully getting pregnant. Your initial consultation, it can be done at the comfort of your own home or in a consultation in person. In this consultation, a fertility specialist will review your medical history and with you will allow you to go through diagnostics so that we can comprehensively assess your fertility. Not only making sure of we know what's your ovarian reserve, but also that we also can analyze your partner semen. Obviously, some blood analysis need to be done in order to keep up with legislation, especially in terms of serologies. After your diagnostic has been assessed, and together with us, you will be given the opportunity to discuss in a very thorough way what your different treatment options are actually in place, so that you can know that there's not a single pathway, that there are multiple ways of getting to your goal, and we will provide with all the information in the most transparent way possible so that you can choose which pathway you want. After planning has been done, you can also do a nursing consultation at the comfort of your home or in a consultation in person with the nurse, and your Ovom nurse will explain you thoroughly how to deal with medication and how does that work for you. Also, bear in mind that you will still keep your Fertility Companion app, that it's a very powerful tool to make sure that you're taking the right medication at the right time. Throughout stimulation, and this may occur over a period of 10 to 14 days, you will have blood works and ultrasounds to monitor how well your body is actually reacting to the medications. And this can be done locally in the US, or it can all be done here in Portugal or in the United Kingdom. This part of the journey, once you've reached a certain point where you are ready for egg collection, this needs to be done in our clinics, either in London or in Portugal. And egg collection is generally performed under anesthesia. So it's a procedure, a fairly simple procedure that takes about 15 to 20 minutes. And then afterwards, you can rest in your own private room with nursing care. As soon as you get up and as soon as you feel right to continue everything, you will get immediate results again throughout the app. The number of eggs that you collected, the quality of eggs, and also the quality of sperm can be monitored through the app. It will look a little bit like you are inside of the lab because you can monitor everything that's going on with your embryos. And as soon as the embryo reaches a blastocyst stage on day 5, then you come back so that we can perform your embryo transfer, which is again done under ultrasound imaging, so that we are sure of what we are seeing and where the embryo is going. Talking a little bit about the technology, what makes our clinic a little bit different from the remaining others. Starting from the semen analysis, and here we have software based on artificial intelligence that can, through the computer, can assist you on the sperm collection and selection in terms of motility, but also in terms of morphology. So as you can see here on this video that I'm playing, the software will choose which sperm is best qualified for us to do the procedure with. Also, ICSI, which is one of the procedures that we do, is also assisted by artificial intelligence. And we use time-lapse imaging incubators, so there's no need for us to take the embryos out of their perfect conditions to check on them, and that is done 24/7 with an embryo assessment, with, again, an AI tool that will better enhance the knowledge and the decision to choose one embryo or the other in terms of transfer. When you have more embryos than the ones that you need for transfer, in classical terms, you would use these devices here where you would storage your embryos. But at Ovom, and especially at Ovom Portugal, we are moving tomorrow. And that's the name of this machine. It's the Tomorrow machine. It's a machine that will allow cryo storage. It's digitally labeling using radio frequency ID technology. It's fully automated embryo management. It's a proactive 24/7 monitoring with more than 1 million monitors a day with daily checks. And patient can actually access real-time embryo data. So this is actually cutting-edge technology that we are actually going to have in Portugal. And this is a video of Dr. Christina using the Tomorrow machine. So after we've been through the whole process and how we get you from A to B, you might have some questions, you might have some doubts, and these are some of the most frequent questions that people have. For instance, if I have not made myself clear enough, how long do you really need to stay in Portugal for an IVF procedure? And this actually depends on the specific treatment plan that you have, and also whether or not you want to do it totally in Portugal, or if you want to do a hybrid where you are monitored at your country and then you just come for the egg collection and embryo transfer. And if you do that, it will take you around a week between going through the egg retrieval and the embryo transfer. But for instance, if you want to include the stimulation and the monitoring, then it's better for you to save 2 to 3 weeks so that you can do the whole procedure in Portugal. Another question is, do you need to have blood tests done before treatment? Yes. Any person whose gametes, eggs or sperms, that enter the lab must have blood tests, serologies for syphilis, hepatitis B and C, and HIV. That needs to be done previously in the last 365 days. So it must be done within a week, within a year. And what I'm telling this about is that we actually need for you to send us the results of these serologies that you've done in the certified laboratory with the clearly with the name of the laboratory, with the date that it was done, and with the result. And you can update that and you can upload those results through the app. You don't need to send them through email or through mail, nothing. It's all doing through the app. Also, depending on the country that you're coming from, you may require additional testing, such as HTLV. Another question is, what fertility services are actually performed in Portugal? Well, the majority of them, or all of them. So you can do intrauterine insemination, classical IVF, ICSI, which is the one that I showed in the video, also the frozen embryo transfer, pre-genetic testing, egg freezing, sperm freezing, donor treatments, or even you can also do ROPA. And here comes another question, which is, what is ROPA? So can same-sex female couple access ROPA, which is reception of oocytes from a partner? And the answer is yes, in Portugal, that's allowed. Does non-anonymity in gamete donation means that the patient couple can bring his or her own donor? No. Not anonymity means that a person that is born from a technique using a donor has the right to know the donor's identity once he or she reaches of legal age. However, donor's gametes always need to come from unknown anonymous donor. For example, it's not possible to use from a friend, a known person, or even a family member. Is surrogacy legal in Portugal? Well, actually, it is legal, but it's still not performed nowadays because it needs further regulation from the legislator. So in practical terms, it's still not performed, but it's considered to be legal in Portugal. So now if you just go to your bottom monitor and you check this sort of Squid Game symbol, which is the triangle, the square, and the circle. And if you press that, you go to Q&A, and if you want to add a question, you just press it, and you can do it fairly easy.
Thank you, Renato.
Thank you for all of your questions. Thank you, Leslie.
Great. So yes, now we'll turn over to you in the audience to ask questions. So as Renato said, I will now open the live chat. And then if you can just go at the bottom of your screen, click on the little triangle like it's indicated here, click on Q&A and ask a question. And there you can just type your questions and I will read them out for Renato to answer. Please note all questions will be anonymous, so feel free to ask anything you're comfortable with. So I will wait for the first question to pop up. So first question, will I need to take time off work for the entire IVF process? Renato, I'll let you answer.
No. That was what I was trying to explain. So we'll try to keep the bare minimum in terms of complicating your life and your work schedule and everything. So you can do it in a hybrid situation where we can, through our associate partners in the US and the UK, you can do the monitoring throughout all the monitoring in the US and the UK, and then you just come for Portugal for the egg retrieval and for the embryo transfer, which will take you around approximately 1 week to do that. But the rest, you can do it locally.
Great. We have a few questions popping up, so feel free to continue writing them. So next question is, can a same-sex male couple have treatment in Portugal?
Well, Portugal is actually one of the most fast-forward countries in the world in terms of human rights. But no, male and male couple are not allowed to do treatments in Portugal. Perhaps after surrogacy law has been regulated, then we'll probably will have some male couples doing treatment.
Great. Let's see how this develops. Next question we have: can I administer the medication myself?
Yes, obviously, that's what we want you to do. Yeah, that's what the intention of the nurse consultation is for. So you will have your OVA nurse that will thoroughly explain you how to self-administer the drugs by yourself. The majority of drugs that we use in IVF are already designed in a way that you can self-administer them. And if you have any doubts, you will always have your fertility companion app, which has not only the reminder of which drug and what is the dose that you need to take on a certain or a given day, but also it will have and it will provide you with further information on how to do it.
Great. I have a few more questions in the chat. Feel free to keep that coming in. So next one is, what are the potential side effects of ovarian stimulation?
Well, the majority of people don't have very severe side effects. The side effects are very mild. They are very tolerable. However, you need to take into account that you may develop ovarian hyperstimulation syndrome, which is a little bit more of a serious condition. But again, that's something that will be monitored, that will be checked, and the doctor that's going to assist you will get you through it with minimum side effects.
Nice. Next question. Can I do an IVF cycle with the intention of freezing and storing embryos in the future?
No, that's not a possible thing. So the intent that's something that we cannot do. We can do IVF in order to get embryos, so that when you have the intention of getting pregnant, and then when you have an excess of embryos created during that procedure, they can be cryopreserved or cryo-stored for instance, if you want to have a baby number 2, baby number 3, baby number 5. So it will depend on your family planning, how many kids you actually want to have. And there's always that possibility, but creating embryos with the sole intention of just cryo-storing them, that's not a possibility in terms of legal terms.
Next question we have is there an age limit to have fertility treatment in Portugal?
Oh, that's actually a very nice question to ask, because that's one of the things that we really need to take into consideration, taking governments and the legislation that is in Portugal up to today. So you are entitled to do any treatment until 49 years of age and 365 days. As soon as you complete 50 years of age, you are no longer a candidate to do any sort of procedure.
Okay, nice. Next question is more about travel. So I guess this person is coming from abroad. Do I need a visa for medical treatment in Portugal?
Well, that's actually a question that we'll be glad to help you with, but taking into consideration how long it will take the whole procedure, even if you come from the initial consultation and you just go through all of the process here in Portugal, it will depend on the country that you're coming from, but mostly, if you're coming as a tourist, you're allowed to stay in the country for 90 days, and no, the whole process doesn't take that long. So for European citizens, you will not require, since we don't have established borders with our European fellows. But if you're coming from any other place outside of the Schengen area, then you need to check how is visa regulation coming to Portugal. But I think that you can always come as a tourist and do the whole procedure here as well.
Great. I see some people have just joined us, so welcome. And we are at the Q&A session, but it's not too late. If you have any question for Renato, go on your screen at the bottom, go on the little triangle, click Q&A and ask a questions, and we'll try to answer it. Amazing. So next question. Do you speak another language than English and Portuguese at the Ovom Portugal clinic?
Well, that's a nice question. Is it personal? It's just for me?
I guess it's for the entire team, but also the
we have a multinational team, so we have people that speak German, we have people that speak Hindu, we have some people that I think that can manage Mandarin. I'm actually on a Mandarin course myself, but I'm not fluent yet. I also speak French. I think that Joaquin also speaks French as well. Some Italian, a little bit of Italian. I can go with Italian. And I think that we cover most of the language.
Yes,
yeah, and Spanish. Spanish for sure, yeah.
Yes, we indeed have an international team with a lot of languages spoken, but if we don't have a language in-house, we will have also translators available as necessary. So we will make sure to understand you. Next question we have is, how does IVF differ with ICSI?
Well, in IVF, just to put it in very simple terms. So in the IVF, you have the dish, you have the egg that you've retrieved, the oocyte, and then you just put a known quantity of concentration of sperm, and you allow the process to be done almost naturally. So the best and the fittest sperm just goes inside the egg and fertilizes the egg. In ICSI, and ICSI is generally reserved for situations where we have actually a male infertility factor, a severe male infertility factor, where we don't have that much to work with. So we don't have that many sperm to work with. And that's why you use that tool that we have, which is a computer-assisted sperm analysis, where we can actually see from the sample which is the best and the fittest sperm to fertilize the egg that we have, so that we actually can create an embryo.
Great, that's much clearer now. Next question we have is, can IVF work for women with low ovarian reserve?
Yes, obviously, yes. It's one of the situations where there is a medical indication for IVF. Obviously, we cannot, when we have a low ovarian reserve, we can be a little bit prudent in terms of our success rates and the amount of eggs that we are going to retrieve in that particular setting. But it's actually something that can be done, and that will actually warrant a pregnancy to that woman.
Great. We have a few more questions, but feel free to type any other questions that you have. Next question is, are there any long-term effects of IVF on children?
Up to this date, there has been thorough, and we have to go back to Louis Brown in the 80s. So we have a fair amount of data and years. And all the papers that have been published, there are no association between a certain disease, a certain condition, whether it comes from an IVF pregnancy or if it's a natural conceived one. So there's no scientific proof that that's something that happens. I think that was one of the very old-time ancient myth associated with IVF and the fear that people had, that as soon as time goes by and you start to see that actually the data is very robust and there's actually no evidence in that way people feel more reassured and safe.
Great. Someone else asked, can I undergo IVF if I have endometriosis?
Yes, you can. Yes, that's alongside with lower ovarian reserve. That's another medical indication for IVF. That's one of the other situations where perhaps pregnancy can obviously occur spontaneously, but that's one of the other conditions that will put women at a higher risk of not being able to conceive naturally.
Great. A non-medical question. Someone is asking, when is your clinic opening in Portugal?
That I'm going to leave up to you, Leslie.
I will answer that. So we're opening the clinic towards the end of the year, so very soon, and we're already conducting non-medical consultation with Dr. Renato Martins and also Dr. Joachim. So feel free to book a meeting with us, and we can add you to the Portugal waitlist. Next question we have is, how do you improve success rates in IVF? What technology are you using there?
Yeah, that's an amazing question, because the whole scope of the technology that I've shown actually enhances a great deal of our success rates. So having artificial intelligence, and when we're talking about artificial intelligence, we're not talking about computer automation. So it's not the machine is able to learn. So we feed them with data, and then she actually is able to select which data is more relevant to that case, so that she can learn and further enhance our models and our predictor models. And that's actually something very, very, very nice to offer. And Ovom patients will be able to get that as part of the package of IVF that we do.
Great. Let's see if we have any more questions. Feel free to add them in the chat. Okay, one more. Are there any lifestyle changes recommendation during IVF in terms of nutrition, exercise, etc.?
Yes. So as any medical condition, as any thing in your own personal life, eat well, be healthy, try to lose some weight. We know that higher BMI have lower probability of getting pregnant, and also will especially in the higher BMIs, will definitely be more of a high risk pregnancy. So if you can lose some weight, you can exercise, eat healthy, stop smoking, or reduce the amount of smoke that you do, the drugs, everything. So just have a healthy lifestyle, and that's a way to enhance your fertility as well.
Yes, indeed. There's a follow-up question from this. Is there a BMI limit for IVF in Portugal?
No. There's the BMI. It's a very controversial issue, because you have to weigh two things: the time that you will require to lose weight in order to achieve a certain BMI, and that's time consuming. So that's time going, especially talking about women. That's time that we are wasting, especially if you're talking about women of a certain age. So if you tell women now you need to waste 2 or 3 years so that you can lower your BMI, then you're actually not doing her any good, because you know that there is a decline in terms of fertility associated with age of women. So if you actually say to women that you actually need them to waste 2 or 3 years that are precious years in terms of the quality of their eggs, in terms of the number of eggs that she has, in order for you to achieve a certain number in terms of BMI, that's more harmful than actually doing the procedure at the time being. With that being said, it's obvious that if someone is considering going through IVF and is already overweight, at least try to reduce some of the weight. It will enhance and it will put your probability higher, and it will enhance the effect of everything and the possibility of getting pregnant. But no, there is no limit. There's no set limit in terms of BMI.
Indeed. Okay, I think we have time for one last question. So let's see. Okay, one question is, what are the cost savings that can be factored in when doing treatment in Portugal rather than the UK?
I think that's for you, Leslie.
Yes, I will answer that. So if you did not attend the presentation at the beginning, we'll of course send you the recording, but Renato explained in detail. When all costs are factored in, including treatment, travel, etc., Ovom Portugal is up to 30% cheaper compared to the UK, and also up to 70% cheaper compared to the US. So that's a huge cost benefit that fits Ovum Care's mission to make fertility treatment more accessible and more affordable. So we'll be happy for you to book a call with us to explain more detail how we can also support you financially and with our flexible financing options and success-based pricing. Great. Well, I think that's unfortunately all the questions we have time for tonight. So thank you so much, everybody, for joining. And we also wanted to share a little gift before you go. So we'd like to offer every one of you a free one-on-one meeting with Dr. Renato. If you're interested to know more about Ovum Care Portugal and to discuss your personal circumstances and reproductive goals with him. And we'll also offer you a free one-on-one meeting with our co-founder, CEO, and patient advocate, Felicia, to go through any question you may have on our pricing model and flexible financing options. So please check your inboxes after this webinar, and you'll receive an email with all the relevant booking links. Thank you so much, everybody, for joining us this evening. We look forward to seeing you again, and have a good evening. Bye-bye.